Welcome to our video on understanding face pigments and their solutions. Facial pigmentation can be a concern for many, but with the right knowledge, it can be managed. Let's dive into the causes and treatments. 1. Sun exposure. UV rays can cause sunspots. Solution: use broad-spectrum sunscreen daily. 2. Melasma. Dark patches often due to hormonal changes. Solution: topical lightening agents and chemical peels. 3. Post-inflammatory hyperpigmentation, dark spots after acne or injury. Solution: retinoids and vitamin C serums. 4. Freckles, small brown spots due to genetics and sun exposure. Solution: laser treatments. 5. Age spots, flat, brown spots due to aging and sun damage. Solution: lightening creams and cryotherapy. 6. Birthmarks, discolorations present at birth. Solution: depending on the type, laser therapy might help. 7. Vitiligo, loss of pigment causing white patches. Solution: corticosteroid creams and UVB light therapy. 8. Rosacea, redness, and visible blood vessels. Solution: topical treatments and oral medications. 9. Tanning, darkening of the skin. Solution: avoid prolonged sun exposure and tanning beds. 10. Medical conditions. Some diseases can cause pigmentation. Solution: treat the underlying condition. Thanks for watching and gaining insight into facial pigmentation. Remember, always consult a dermatologist for skin concerns. Don't forget to subscribe to our channel for more skincare insights.